Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department doing our 4 millionth COVID-19 update. Just kidding. Today's February 11th, 2022. Our website is falmouthma.gov. Our email is health@falmouthma.gov. And our phone number is 508-495-7485 if you need to call the health department. So we had a better week. It's still trending well. 3,989, so 3,989 total cases with 61 this week. 7 probable, both are lower. Our 14-day incidence rate, which gathers some of the higher numbers from a couple weeks ago, 120, because the state provides it 2 full weeks prior to the Thursday posting, so it's already 5 days old, is between 123 and 25, and that was, it's down from 62.1 down to 42.4, and that daily incidence rate is how many cases Falmouth would have if it had a population of 100,000 people. Falmouth's 14-day positivity is 8.8, previously 12.1, same time frame. If you look at our case count weekly chart, you can see we've had 1, 2, 3, 4, 5 weeks of decline after 3 weeks of real fast increase. So the spike has done its thing, and it's down in that sort of normal, not normal, I don't know what normal is, but more in what we were in that sort of early December, late November time frame, where we're between 50 and 100. As we get closer to zero, we're not going to have that such a high sharp decline, but you still see a relatively significant decline from 80 down to 60. And this number gets taken on Thursday, and I don't see anything different, at least of today's case count. So, that's a good sign that the spike that we had went down. This chart here, again, closer the dots are together, and the flatter that line is, the better we're doing. So you can start seeing it flatten and tightening, which means we're getting back to more of a flatter, less of an issue, less of an outbreak that we did see those several weeks that we just had. So in terms of county, these are the county numbers. You're seeing a very similar trend. They're down for the last week or so. We're down, last couple of weeks. It's been dropping. Same with us. So that's good. Deaths were up over the last week. I didn't forget to put that slide in there. They're a lagging indicator of the high case counts. And there are still people that aren't vaccinated. There are those that are vaccinated but are of ill health or very elderly. So there's still there was I think as high as 14 on a 3-day total. Kind of similar to what we were seeing back in this time frame last year, with much less cases. Again, Omicron is definitely it causes less severe illness, and also now we have a vaccine and a booster, and treatment's right around the corner. So that's where we are with that. Statewide, last week when I reported, we were over 4,000. We're at 2,000, so that's about a 50% decrease. The positivities, this is the most recent 7-day, so it's a little different from the one that I showed you before, and I'll show you in a slide further down. The most recent 7-day average is down 3.8, so it's really kind of getting down. You want to be less than 2. Less than 3 is okay, but less than 2 is even better. And so you're starting to see those numbers come way down. You see it in the trends. In blue, you see that sharp spike downward like we're seeing with cases. Hospitalizations are down. You'll see that as well here. Positivity's dropping, everything's dropping, which is great. To tell you that this most recent spike or outbreak from Omicron is waning, and deaths are also on a decline as well. So 5 in the hospital, 1 in the ICU in Falmouth, total number 27 and 4, much less than 120-22 down below, where you saw 65 and 7 between the two. So the numbers are definitely better from a hospitalization rate. And looking at last year, one of the things I failed to mention to you guys, if you look at these numbers from last year, these are hospitalizations from last year, you see much more ICU as a percentage of all cases compared to what you're seeing up here, 2, 4, 43 and 5 versus 23 and 7. There were more people in the ICU with half the cases. So this is definitely got to do with the vaccine, the boosters, and Omicron itself. Daily incidence rate, the state at this same time frame, 62.2, so our cases were at 42.2, so we have a lower incidence rate than the rest of the state, and we're about middle ground for all other towns at Barnstable County. Positivity was still a little bit higher, where Massachusetts for that time frame was at 7, we were at 8, so we're still a little high on the positivity. That will definitely, well, unless something happens next week, definitely on a downward trend. Remember, these two only captured data to the 5th, and that's 6 days ago, and these last 6 days, the case counts have been even lower. So, you know, that number, these two numbers here and there should be lower next week, barring some, you know, huge thing that might occur next week. I don't feel that happening. I always love to show this chart. This is fully vaccinated individuals and breakthrough cases. There's been 434,394 breakthrough cases, which is 8.3% of the population that's been vaccinated. The hospitalization rate has been 6,790 or 1.56, so it's been right around that 1.5, 1.4, 1.3, 1.5. It's dropped down since with Omicron. And also, so that's the hospitalization rate. So out of every 100 people that have a breakthrough case, 1.5 or 2 end up in the hospital. That's, you know, fairly low. You'd say that's getting similar to what we'd see in a respiratory viral year pre-COVID. You know, you're not too far off. I mean, people do, you know, we do have nursing home cases and deaths associated with flus prior to prior to COVID. So you're starting getting down into those lower numbers. Not that 6,000's a good thing, but still, it's as a percentage of whole, 2 people out of every 100 that have been vaccinated and got COVID end up in the hospital. Population in general, 0.13% of all those that have been vaccinated and boosted have been hospitalized, so well under 1%. As far as deaths, again, 0.46% of all cases have had resulted in death of breakthrough cases, so far less than 1%. And among everybody who's been vaccinated, those that have not had a breakthrough cases, it's even lower, so obviously, so 0.04%. So this is always, like I call this the silver lining slide. This is telling you that the vaccines are working, and that number dropped when Omicron came in. Those numbers were, I think, right around 4% as opposed to 1.5% when it was all Delta, and now it's all Omicron. And we had similar vaccination rates in the fall when this number might have been 3 or 4%. So that tells me that's the add-on from having Omicron be more upper respiratory, generally less. Again, if you're not vaccinated, still somewhat weaker, but your hospitalization rates are much higher. Maybe I'll look that up for next week if I remember. But this is for vaccinated people. So you've been vaccinated and boosted, your likelihood of being hospitalized or death is quite low. Vaccinations, we picked up 268 doses, 45 firsts, 57 seconds, 166 boosters. 96% of all eligible residents have had at least 1 dose, and 84% of all eligible residents are fully vaccinated. So this is a fair percentage of people that didn't want to get a second dose after they got their first one for whatever reason, but still strong numbers nonetheless. Okay, and that data is up 2.8. There is some rumblings about maybe the future of what's going to happen with boosters and what's going to be considered fully vaccinated. I've heard different stories, none of them which, you know, I would say is inked in stone, but maybe perhaps the very weakened immune system, the very elderly, might be doing a 3-dose series. I've heard that, I read that, but take it with a grain of salt. I don't have anything definitive other than our current course of 2-dose or 1-dose, depends if you got J&J versus Moderna or Pfizer, and a booster at least 5 months after, or 2 months for J&J, that still applies. There's no talk of a 4th dose per se or an extra booster, but I think that's some more guidance will come out, especially would have to come out. You know, respiratory viruses, you know, the saying of, you know, when you're wearing shorts and it's warm out, respiratory viruses go down. We know that, we've known that prior to COVID. And they peak back up in the fall, late fall, right around Thanksgiving. And that being said, you know, I'm sure there'll be some guidance before Thanksgiving on whether, you know, people that have already been boosted a year ago will need it and sometime in that, but I don't have any data. When I do, I'll post it, but I don't have anything definitive on the future for vaccines, and that's where we are with that. Our metrics, we went from high to substantial for our positivity because we dropped on the 10. We're still high, but way lower than over 1,000 that we were for the incidence rate multiplied by 7. You know, anything under 100. We probably won't get there, but we might get close next week, hopefully, if we continue the similar trend. Definitely on a downward trend for that. Hospitalizations, doing fairly well with that, all things considered. And again, our vaccination rates are really good. So that's it for cases. Vaccine availability is vaxfinder.mass.gov. with these vaccination numbers being in a couple hundred, there should be no problem getting vaccine. You can just go on VaxFinder, and there should be plenty of opportunities. I always want to say those are homebound, or if you come back, especially as some people might come back to their summer homes and they notice that someone's homebound and they like to check up on that person, and that person has not been boosted or vaccinated and wants to, they should be calling. Anyone can call the health department. We can schedule that through the VNA. Booster doses have not changed. You can get this right off. I put this on our website too as well, so you don't have to have it memorized. So boosters are right here. COVID testing, again, school-based testing stay replaced by pool testing and home testing. Home kits are around. Convenient MD still doing testing. CVS still does it. Falmouth Hospital still does it. Fairgrounds through the Barnstable County is now using the church for the winter. The Community Health Center, again, home test. And then there's a Stop the Spread site, which is free. It's run by the state at the Melody Tent. Those are the dates, Mondays and Tuesdays and Wednesdays. Mondays and Wednesdays are 9 to 1, and Tuesdays are 1 to 6. Isolation and quarantining guidance has not changed for you. For us, it has. My email gets clicked every time the case comes in, so when I get up in the morning, we have lots of cases, I have lots of emails. That immediate notification, immediate action is actually starting to go away. It's going to be treated more like what we would do with normal diseases. We'd go into our workflows on Maven and the nurses would go through the cases. And it's still going to go through the cases. We'll do a notification like we have been. Nothing's changed with the isolation and guidance. It's still, they've been diagnosed. It's 5 days. If symptoms substantially resolve, you can continue to, you can undo your isolation, but continue to wear a mask for additional 5. Definitely would need the fever to be gone for that. And then whether you've been vaxxed or boosted will determine whether you need to quarantine for 5 or just wear the mask for 10. So they consider fully vaccinated those that have been boosted. Vaccination records, travel. People travel a lot in the winter to get out of here, out of this weather. If you need a vaccination record, you can do it right online. You can go into myvaxrecords.mass.gov and fill out this record. The left-hand side of this slide shows up first, and then your access, and you fill out that information on the right. Okay. Omicron, I didn't change the slide today because it's 100%, it's 100%. It's still the same. It's still since mid-December, basically from the beginning of this year, just about all Omicron. Face covering. So that's where there's been a change. So the state lifted, I'm sure you read that DESI lifted the guidance. So on February 28th, there's no state mandate for schools. The school committee will discuss it on Tuesday. It is left up to individual schools and individual school systems if they want to continue it. They'll discuss that at the school board. There's still a select board mask requirement, town-owned properties. The Board of Health we discuss on our Monday meetings. We have one this Monday, it's every other Monday. They'll discuss whether they want to still continue that recommendation or not. And that'll be a discussion for Board of Health. We talk about COVID every time we have a meeting. And also, but the big change will be that the DESI guidance is schools are no longer required. There will be an individual school decision. And so that, I think the next school committee is this Tuesday, and I'm sure they'll be taking that up. So that's where we are with face coverings. We're still at an advisory everywhere else. So as far as a recap, I really haven't changed much for this. Falmouth case counts are, on the high, I guess, stay high, but they're definitely tapering off. I kept high in there, but 50 to 60, it's still high in terms of its incidence rate, so we'll keep that at high, obviously. But, we are definitely in much better shape for pure number of cases than we were a few weeks ago. Cases are all Omicron. We urge you face covering, especially on your health status, where you're going to be and so forth. Vaccine is eligible. People are eligible if you're over 5. Boosters are eligible, so, consider them. Most people have by our vaccination rates. So that's where we are for the week. And I will do another one next week. Hopefully we're at some number well below 60 cases, and we just keep going on. So that's what I have for this week, and I'll see everybody next week. Thanks.